So coming to the clinical manifestations of retinoblastoma, how all retinoblastoma can present. Classically, we know it presents as the white reflex, that is leukocoria. Okay, so always whenever you have children under 5 years of age coming to your place, just quickly flash a light and see. It is not very difficult, no? So always rule out the white reflex. Then other presentations be strabismus, a new onset strabismus. Please refer to your ophthalmologist friend. Get a good evaluation and then only send. Okay, so many times we have these children and parents do not even go to the ophthalmologist. So make sure they are being examined by an ophthalmologist. Red eye is quite rare. Shrunken eyeballs again, retinal detachment and an orbital mass. So apart from this, there can be decreased vision, hyphema, pain, watering of the eyes because of glaucoma. So all these are symptoms of retinoblastoma. So this is a retinoblastoma tumor, and a gross excision, you will know it is a white chalky retinal mass, very easily friable consistency mass. And biopsy is definitely contraindicated and imaging studies are not very diagnostic. Always under GA, a complete evaluation is mandatory. So the next diagnosis, so you have a white reflex, you have sent to your ophthalmology consultant and then they have examined. Next what? Next our point is doing an imaging. So you do an orbital ultrasound, CT or MRI. This will help you to identify where from the origin is there, spread how far it is there, and for metastasis. So MRI will allow you to look at the optic nerve, to look at the brain, to see for mets. Trilateral retinoblastoma is something rare, only 5% of the cases. It means bilateral, that is both eyes are involved along with pineal or a supracellular tumor is present, that is called as a trilateral retinoblastoma. Mets are actually rare at diagnosis, but we need to do LP, bone marrow and bone scan if it is indicated clinically. Okay, so retinoblastoma, Mets are rare at diagnosis, but if indicated clinically, definitely bone marrow and CSF screening has to be done. So this is an entire list which will give you the differential diagnosis of a white reflex, that is leukocoria. So starting from the most common ones, congenital cataract and colobomas, choroidal colobomas, retinopathy of prematurity, PHPV, Coats disease. So you know all this, we have been dealing with this. So let me just move on to the treatment part. Primary goal is always cure. Okay. Secondary goal is preserving the vision. So primary goal is getting rid of the tumor. That is our primary goal. Secondary goal is having a good vision and decreasing the side effect. So now with the advent of systemic chemotherapy, enucleation is performed less often than the previous era. So if there is an unilateral tumor, okay, if it is a very large tumor and if vision cannot be salvaged, enucleation is done. If it is a small tumor, you avoid enucleation, go for chemoreduction or a focal therapy. If it is a bilateral tumor, do a focal therapy, chemoreduction. So our aim is to not do enucleation. Okay, that is what we are aiming here. So small tumors, you do focal therapy. Focal therapy means focal laser photocoagulation. That is a focal therapy and follow it up. Larger tumors, along with focal therapy, give chemotherapy, multi-agent chemotherapy with carboplatin, vincristine and etoposide.